Imagine a scenario that unfolds nightly, a quiet transition from wakefulness to slumber, a ritual so ingrained that its potential for harm remains utterly undetected. You drift off, anticipating the restorative balm of sleep, a period of unconscious rejuvenation. Yet, as you lie there, oblivious to the subtle physiological shifts occurring within, you might be unwittingly engaging in behaviors that are, by their very nature, placing your brain at an escalating risk. The terror of a stroke lies not in its announcement, but in its silent, unheralded arrival. It can strike without the preamble of blinding pain, without the dizzying premonition, without any discernible twinge of discomfort to herald its approach. It can steal your ability to articulate, to move, to simply be, all in the space of a few hours, leaving behind a desolate landscape of lost independence. While societal awareness often points to factors like smoking, a sedentary lifestyle, or a diet laden with unhealthy fats as primary contributors to cardiovascular and cerebrovascular events, there exists a far more insidious yet common set of culprits: your everyday sleeping habits. For many individuals, particularly those navigating the seasoned years of life, the unconscious decisions made each night regarding sleep posture, environmental factors, and even subtle pre-sleep rituals can become silent architects of neurological peril. As a physician dedicated to the intricacies of the brain, I have borne witness to the devastating aftermath of these seemingly innocuous practices far too frequently. It is a sobering reality that the very things we do to find comfort and rest can, paradoxically, become the silent adversaries of our brain health. These common, everyday sleeping habits that most seniors believe are completely harmless are quietly, insidiously raising the risk of stroke, brain bleeds, or dangerous spikes in blood pressure, especially during those crucial quiet hours when your brain is at its most vulnerable, operating in a state where its defenses are naturally lowered. If you are over the age of 60, or if you hold dear someone who is, the knowledge contained within this discourse could literally be the difference between life and a devastating impairment, or even life and death. This information is far too vital to be dismissed or overlooked. Let us embark on a journey to illuminate these hidden dangers, to understand the profound impact of our sleeping practices, and to reclaim control over our brain's destiny one night at a time. This is not merely about sleeping better, it is about sleeping smarter and ultimately sleeping safer. One of the most pervasive and seemingly benign sleeping positions, a posture embraced by many for its perceived comfort and simplicity, is lying flat on your back without any elevation beneath your head. This is the epitome of natural repose, a return to a primal state of rest with the mattress supporting your entire frame, your limbs resting peacefully by your sides. Proponents of this position often cite its benefits for alleviating back pain or promoting a sense of open chest expansion for deeper respiration. However, the silent truth, a truth seldom voiced or understood, is that sleeping in this completely horizontal state, with your head perfectly level with your heart, can significantly and insidiously escalate your risk of experiencing a stroke, and you may never even register the escalating danger. As the human body gracefully ages, our blood vessels, particularly those in the neck and brain that are responsible for maintaining vital blood flow, naturally undergo a process of reduced flexibility. This means that blood, that life-sustaining fluid, does not traverse these crucial pathways with the same effortless ease it once did. When you adopt a flat sleeping posture, the complex network of veins tasked with draining blood away from the brain are forced to work against the unyielding force of gravity. Instead of experiencing a smooth, unhindered flow, blood can begin to pool, its progress slowing to a sluggish pace. In this state of reduced flow, the propensity for dangerous blood clots to form increases exponentially, especially during the early morning hours when your body's natural circadian rhythm dictates a rise in blood pressure. A small thrombus or clot forming within a narrowed arterial lumen can precipitate a cascade of devastating neurological events, leading to the hallmark symptoms of stroke, such as slurred speech, a drooping facial appearance, permanent disability, or, in the most tragic instances, death. Consider the poignant case of Mr. Leonard Whitaker, a 77-year-old retired mechanic whose life was irrevocably altered by a lifelong habit he believed was conducive to deep sleep. He had consistently slept flat on his back, foregoing any pillow, a practice he adopted during his service in the Navy, convinced it facilitated more profound rest. One fateful morning, his devoted wife discovered him in a state of profound disorientation, utterly incapable of forming coherent words, his face bearing the telltale droop on one side and his left arm rendered immobile. A swift transfer to the hospital and subsequent neurological imaging revealed the presence of a significant clot within his brain, a clear instance of ischemic stroke directly attributed to his sleeping position and the resultant blood pooling within his increasingly stiffened neck arteries. While the medical team was able to successfully dissolve the clot, Leonard's life was irrevocably transformed. He experienced persistent difficulties with speech, and his mobility was so compromised that he required the assistance of a walker. His wife now ensures that he sleeps with his head slightly elevated on a specially designed wedge pillow, a simple intervention that both of them wished they had understood the critical importance of years prior. The fundamental physiological issue at play here is that when you lie completely flat, especially when coupled with the vascular changes that are an inherent part of the aging process, the natural venous drainage from your brain becomes compromised. Your brain's intricate internal plumbing system, its vascular network, slows down, and stagnant blood can unfortunately become a fertile breeding ground for clot formation, a risk further amplified by dehydration and the potential for reduced oxygen levels that can occur during the extended period of sleep. This particular sleeping position is especially perilous for seniors who may have pre-existing conditions such as hypertension, atrial fibrillation, diagnosed sleep apnea, or a history of carotid artery disease. It also poses a heightened risk for individuals taking medications that affect blood pressure, as these can sometimes lower it too dramatically during the nocturnal hours. The simplest, yet most profoundly effective adjustment you can make to mitigate this risk is to elevate your head slightly, achieving an angle of approximately 30 degrees. This subtle elevation allows gravity to assist the natural flow of blood, reducing the pressure within the skull, and ensuring that your brain receives a more consistent and even supply of oxygen. Even the judicious use of 1 or 2 supportive pillows can translate into a significant difference in safeguarding your vascular health. This is not merely a matter of personal comfort. It is a critical measure for ensuring the healthy, uninterrupted flow of blood to your brain, thereby protecting your independence, your cognitive faculties, your ability to communicate, and indeed, the very essence of your being. Leonard himself, with tears welling in his eyes, once confided, "Doctor, if someone had simply informed me that sleeping flat could lead to this, I would have made that change years ago. Let me be that voice of knowledge for you today, urging you to make this vital adjustment." Among the myriad of sleeping positions, the prone position, commonly known as sleeping on your stomach, holds a particularly insidious potential for harm, especially as we advance in years. While it may feel deeply comforting, a familiar embrace that lulls you into sleep, it is a posture that harbors significant, often unacknowledged, dangers to your brain's vital lifeline. Many older adults, perhaps seeking relief from back discomfort or simply enjoying the sensation of pressure on their chest, adopt this sleeping habit without a second thought. However, it is my professional duty to share a crucial piece of information that you may not readily receive from your primary care physician. Sleeping face down can very well be one of the most perilous positions for your brain's blood supply. While this position, medically termed the prone position, might not induce significant harm in younger, more resilient bodies. As we age, our circulatory systems naturally tend to slow, our arteries can become stiffer and less pliable, and our overall oxygen saturation levels can dip more readily, particularly during the deepest stages of sleep when our bodies are in a state of profound relaxation. The fundamental problem with stomach sleeping lies in the enforced contortion of your neck. To facilitate breathing, your head is invariably forced to turn sharply to one side, a position that can significantly compress the vertebral arteries. These arteries are the critical conduits that transport oxygen-rich blood from the spinal column up to the posterior regions of your brain, areas that are profoundly responsible for a host of essential functions, including maintaining balance, coordinating movements, and even regulating consciousness. However, the danger does not cease with the compression of the vertebral arteries. This posture also exerts considerable pressure on the carotid arteries, especially if your head sinks into a soft pillow or a yielding mattress. This compression, in turn, impedes the smooth flow of blood, effectively kinking the veins that are meant to carry blood away from the brain. The consequence of this obstructed flow is the potential for stagnant blood to collect and consequently thicken. For individuals whose vascular systems are already vulnerable due to age or underlying conditions, this stagnant blood can coalesce into dangerous blood clots. These clots might remain dormant for many hours, only to be dislodged by the natural surge in blood pressure that characteristically occurs in the early morning hours. Once dislodged, these clots can travel unimpeded into the brain, leading to a stroke, often a severe and incapacitating one, sometimes with fatal repercussions. I vividly recall Mrs. Ethel Lawson, an 82-year-old retired school teacher, who presented to my clinic after a truly terrifying ordeal. Her daughter discovered her one morning lying awkwardly on her stomach, her speech slurred and garbled, and her left side completely unresponsive. Upon rapid transport to the hospital, neurological scans revealed a substantial ischemic stroke affecting her cerebellum, the critical part of the brain responsible for motor control, coordination, and balance. The underlying cause was not attributable to high cholesterol or pre-existing heart conditions. Ethel's arteries had predictably narrowed with age, and the hours spent sleeping face down with her neck twisted had significantly reduced blood flow to her brain, creating an environment where a clot could easily form. By morning, the irreversible damage had been inflicted. Ethel survived the stroke, but her life was permanently altered. She could no longer drive and required a walker for even short distances. She often laments to me, "I had no idea that something as simple as how I slept could nearly take my life." Scientifically speaking, neck rotation in the prone position can reduce vertebral artery blood flow by as much as 40%, a figure that can escalate if the pillow forces the head into an extended backward position. Furthermore, the compression of the chest cavity in this position can restrict lung expansion, leading to a measurable decrease in oxygen saturation levels, which in turn places additional undue stress on both the heart and the brain. Obstructed airflow can also contribute to an increase in carbon dioxide retention within the bloodstream, further altering brain blood flow dynamics and frequently leading to vascular instability. As our bodies age, they become inherently less tolerant of oxygen deprivation. Our natural response mechanisms to such deficits slow down considerably. While a 30-year-old might instinctively gasp for air and reposition themselves during a mild oxygen dip, an individual in their 70s or 80s might experience a similar drop in oxygen without any conscious awareness, silently and insidiously setting the stage for a stroke during the vulnerable hours of sleep. This risk is even more pronounced if you suffer from snoring, have diagnosed sleep apnea, or are taking sedative medications or sleep aids, as these conditions and substances further compromise your body's responsiveness, increase the likelihood of airway collapse, and dramatically elevate the risk of a silent, oxygen-starved stroke. If you or a loved one habitually sleeps on your stomach, I implore you to make a conscious effort to switch to sleeping on your side, perhaps utilizing a firm pillow that helps maintain proper head alignment, or ideally, sleeping slightly elevated on your left side to promote optimal brain and heart circulation. These are not merely choices related to comfort, they are choices that can profoundly impact your very survival, as what feels cozy and familiar might be exerting deadly pressure on the very arteries that sustain your brain's life. And it is crucial to remember that it is not solely the sleeping position itself that poses a danger, but also the specific areas of pressure that build up within that position. In the subsequent sections, we will explore a habit that millions of seniors fall into, often as a response to pain, a habit that can silently yet critically impede blood flow to the brain. A small, deeply personal habit often accompanies individuals into their advanced years, a comforting ritual that feels almost childlike in its familiarity, performed without conscious thought or deliberation. The practice of pulling the blanket entirely over one's head at night. Perhaps this habit is born out of a desire to muffle the ambient sounds of a snoring partner, the incessant drone of a ceiling fan, or the intrusion of ambient light from a street lamp. Alternatively, it might stem from a perceived draftiness in the room, or simply the profound sense of peace and security that emanates from being enveloped within a warm, silent cocoon. However, for older adults, this seemingly innocent, even comforting nighttime ritual can subtly and insidiously transform into a deadly threat. When you sleep with a heavy blanket pulled entirely over your head, you are not merely dampening sound or obscuring light. You are severely and critically limiting the availability of fresh oxygenated air. Over the course of the night, the levels of oxygen within that confined space plummet drastically, while carbon dioxide, the waste gas that we exhale, begins to accumulate around your nose and mouth. While your younger body, with its robust physiological reserves, might have tolerated such conditions decades ago with minimal adverse effects, at the age of 60, 70, or 80, your brain's capacity to recover from these periods of oxygen deficit is significantly diminished. This combination of reduced oxygen and elevated carbon dioxide levels during sleep creates a potent environment that significantly escalates the risk of your blood thickening, and in brains that are particularly vulnerable, this thickening can precipitate the formation of dangerous blood clots. Allow me to recount the experience of Mr. Richard Hale, an 81-year-old retired postmaster. Richard was a quiet, contemplative individual who deeply cherished the feeling of sleeping in complete darkness, a habit he had cultivated since his childhood years. He would frequently pull his covers completely over his head, particularly during the colder months, a practice that often elicited gentle teasing from his wife, who would comment that he resembled a bundled-up caterpillar every night. To Richard, however, it represented a profound sense of safety and deep relaxation. Thus, every evening, he would meticulously tuck himself in, drawing a thick quilt over his head and surrendering to sleep. Then one morning, Richard did not awaken as he normally would. His wife, growing increasingly alarmed by his prolonged unresponsiveness, found him groggy and barely able to open his eyes. Upon the arrival of emergency medical personnel, his blood oxygen saturation levels were critically low. A subsequent diagnostic scan at the hospital revealed that he had suffered a silent stroke in the very early morning hours. A blood clot had formed and subsequently lodged itself in a small vessel deep within his brain, not as a consequence of pre-existing atherosclerosis or atrial fibrillation, but rather due to a combination of oxygen deprivation during sleep, exacerbated by age-related blood thickening, with the heavy blanket pulled over his head serving as a significant contributing factor. You see, during the stages of deep sleep, and particularly during REM sleep cycles, your brain necessitates a consistent and uninterrupted supply of oxygen. When you are rebreathing stale air trapped beneath the covers, your blood oxygen levels inevitably decline. Your heart then attempts to compensate for this deficit by beating more rapidly, and your blood pressure begins to fluctuate in an erratic and unstable manner. These sharp increases and decreases in blood pressure place immense stress on blood vessels that may already be fragile due to the aging process. When you factor in mild dehydration, which is common during sleep, and the natural slowing of circulatory function that accompanies age, you inadvertently create a perfect physiological scenario for a blood clot to form. The truly terrifying aspect of this phenomenon is that you might never become aware that it is happening. You drift off to sleep feeling warm, secure, and protected, but your brain is, in effect, slowly suffocating. By the time the irreversible damage has been done, you may awaken as a fundamentally different person, or, tragically, you may not awaken at all. Numerous medical studies have conclusively demonstrated a robust correlation between even mild hypoxia or reduced oxygen levels during sleep and a significantly elevated risk of stroke and cognitive decline in senior populations. This is not a concern limited solely to individuals who have been formally diagnosed with sleep apnea. It can impact anyone whose breathing patterns are disrupted by their sleeping environment or their chosen sleeping posture. If you find yourself habitually pulling the covers over your head during sleep, even if this behavior is primarily confined to the colder months of the year, it is imperative that you critically re-evaluate this routine. Instead of resorting to pulling the covers up over your head, consider utilizing a comfortable sleep mask to effectively block out light, or employing earplugs to minimize disruptive noise. Ensure that your bedroom is maintained at a pleasant and comfortable temperature, and invest in bedding that is both breathable and lightweight. This is not about enduring discomfort or sacrificing personal preference. It is about actively and consciously protecting your brain by ensuring it receives the vital oxygen it desperately needs to restore, repair, and ultimately survive the night. Strokes, sadly, do not exclusively afflict distant strangers. They can and do affect thoughtful, ordinary individuals like Richard, who remained blissfully unaware that a lifelong habit could inadvertently compromise his ability to walk, talk, and retain his memories. He now sleeps with a supportive wedge pillow, utilizes softer ambient lighting, and ensures his blanket remains carefully folded below his shoulders. He quietly shared with me, "I never comprehended that something which felt so safe could actually be so perilous." And he is certainly not alone in this profound lack of awareness, because it is a stark reality that what we do not know can indeed lead to our detriment, particularly while we are in the state of sleep. However, as perilous as a heavy blanket over the head can be, it pales in comparison to the subsequent habit we will discuss, a habit that millions of older Americans rely upon for comfort, yet one that may be dangerously impeding blood flow to the brain. We are referring to the way you position your arm while you sleep. It feels entirely natural, a secure and integral part of your sleeping posture, yet it might very well be the most damaging habit of all. Allow me to meticulously explain exactly how this occurs. For a considerable segment of the senior population, the act of sleeping can become an increasingly arduous endeavor as the years progress. This difficulty often extends beyond simply falling asleep. It encompasses the challenge of maintaining sleep without experiencing unwelcome pain or persistent discomfort. The cumulative effects of achy joints, a stiffened spine, the uncomfortable symptoms of acid reflux, or the unsettling sensation of shortness of breath can collectively lead to the adoption of a common coping mechanism, the recliner chair. You might personally know someone who has entirely relinquished their bed in favor of the perceived comfort and ease of their recliner, or perhaps that someone is you. Night after night, sleeping in an upright or semi-upright position within the embrace of a recliner becomes a deeply ingrained routine. The gentle warmth of a soft blanket, the soothing hum of the television, the chair angled in a seemingly perfect position, all combine to create an environment that feels secure, a veritable sanctuary of rest. However, what feels inherently safe can, at times, subtly and insidiously become dangerous. As a physician specializing in the intricate workings of the brain, I have personally witnessed the profound impact that this particular sleeping position, the semi-upright posture adopted in a recliner, can have in slowly and silently escalating the risk of stroke during the very hours when one believes they are achieving their most restful sleep. The fundamental physiological reality is that the human body is inherently designed to rest in a horizontal position, a posture that facilitates the even and unimpeded distribution of blood and oxygen throughout its entire circulatory system. However, when you elect to sleep in a semi-upright posture, typically at an angle ranging from 45 to 60 degrees, you are effectively placing your circulatory system at a significant disadvantage, especially as you advance in age. In this elevated position, gravity exerts a dual and detrimental effect. It actively pulls blood downwards, away from the brain, and it simultaneously compresses the major veins located in your legs and hips. This gravitational pull results in sluggish blood flow, a phenomenon that leads to blood pooling in the lower extremities and a substantially increased risk of blood clot formation. While this might not pose an immediate or significant threat to the robust circulatory systems of younger individuals, the situation transforms dramatically for those over the age of 60. Blood can become thicker due to age-related dehydration. Blood vessels can narrow due to decades of cumulative wear and tear, and the heart's pumping efficiency may naturally decline. That slow-moving blood, pooled in the lower body, becomes a prime candidate for forming clots, small, sticky, and alarmingly silent threats that can, during the course of the night or in the early morning hours, embark on a perilous journey upwards. All it takes is for one of these clots to find its way into a vital vessel within the brain, and the irreversible damage is inflicted before you even awaken to its presence. Allow me to share the compelling story of Mrs. Barbara Keene, a 79-year-old retired florist. Barbara was a woman of remarkable grace and charm, possessing a sharp intellect and the gentlest of smiles. She began sleeping in her recliner approximately 5 years ago, following a hip surgery that rendered lying flat extremely uncomfortable. Just until the pain goes away, she would reassure herself. However, the pain persisted, and over time, the recliner evolved from a temporary solution into her primary sleeping place. She would typically awaken feeling stiff, but would manage to carry on with her day. Then, one morning, Barbara did not awaken as usual. Her daughter discovered her still seated in the recliner, exhibiting signs of confusion and struggling to move her left hand. Crucially, she had not experienced a single warning sign preceding this event. However, diagnostic imaging performed at the hospital revealed that she had suffered a lacunar stroke, a small, deep stroke caused by a clot that had lodged in one of the tiny, delicate vessels within her brain. Barbara had no history of significant heart conditions and no diagnosed atrial fibrillation. What she did possess, however, was significantly compromised circulation stemming from years of sleeping in an upright position, which had led to persistently swollen legs and frequently tight ankles. She would often report feeling dizzy upon rising from that chair each morning. Looking back in retrospect, the warning signs were undeniably present. But like countless others, Barbara never truly imagined that a comfortable recliner could subtly yet definitively transform into a dangerous stroke trap. Here is the scientific reality of this phenomenon. Sleeping in an upright position demonstrably reduces the effectiveness of the baroreflex, which is the body's intrinsic system responsible for regulating blood pressure. When you sleep horizontally, your brain and heart can communicate more efficiently to maintain a stable blood pressure. However, when you are positioned upright, particularly if you are tilted forward slightly or have your body twisted, that crucial regulatory reflex is significantly weakened, leading to an increase in blood pressure instability. This instability becomes particularly perilous for senior individuals. When you add to this equation medications, instances of dehydration, or compression from tight-fitting socks or swelling, you are effectively confronting multiple risk factors simultaneously, all while you remain under the comforting illusion that you are simply enjoying a peaceful night's sleep. Therefore, if you are an individual who habitually sleeps in a recliner or enjoys frequent naps in such a chair, please consider this your urgent and necessary wake-up call. Sleep is not merely a passive state of rest, it is a period where the position of your body can actively protect or, conversely, endanger your brain. If you find it absolutely necessary to sleep in an elevated position, it is highly advisable to consider utilizing a hospital-style adjustable bed or a firm, precisely angled wedge that effectively supports your torso without imposing any undue constriction on your lower limbs. Furthermore, It is vital to incorporate regular stretching and movement of your legs to support healthy and unimpeded circulation. Barbara has since made the commendable transition back to sleeping in a conventional bed, ensuring her head is slightly raised and utilizing a body pillow to support her hip. She often reflects with a sense of poignant realization. I thought I was making things easier for myself. I never once considered that I might be making them more dangerous. It is indeed a profound truth that many individuals erroneously assume that the primary danger lies in excessive movement. However, for seniors, the more prevalent and insidious danger often resides in remaining physically still in an incorrect position for prolonged periods. But if you believe that sleeping with your arm trapped might be dangerously impeding blood flow, patiently await our discussion on what transpires when your body experiences constant tossing and turning throughout the entire night, and how that very restlessness might be a critical warning sign that your brain is desperately attempting to transmit before a catastrophic event occurs. Let me illustrate precisely what this signifies. Millions of individuals, particularly those in their senior years, find a particular sleeping position to be remarkably comfortable and secure. It feels natural, almost instinctual, to lie on your right side, to cradle a soft pillow beneath your head, perhaps tuck another between your knees for added support, and then, almost as a deeply ingrained habit, to slide your arm underneath your head or pillow. You then drift off into slumber, believing it to be the same comfortable position you have maintained for decades. However, as a physician dedicated to neurological health, I must impart a critical truth. This position is, in fact, the most perilous sleeping posture I frequently observe among seniors. Its danger is not immediately apparent through pain, but rather through its silent, insidious restriction of vital blood flow to your brain, night after night, subtly yet significantly increasing your risk of experiencing a stroke during the very hours when you believe you are achieving your most secure and restorative rest. Let us meticulously dissect the reasons why this common practice is so profoundly problematic. When you lie on your right side, and particularly when you wedge your arm beneath your head or pillow, you are inadvertently exerting direct pressure on major arteries and veins located in your neck and shoulder region. This compression affects critical vascular pathways such as the carotid artery and the subclavian artery, which function as the primary highways for blood traveling to and from your brain. However, when these vital conduits are compressed for extended periods, the flow of blood slows down dramatically. Blood begins to pool in the veins, the arteries become narrowed, and in the quiet stillness of sleep, this stagnant blood begins to thicken. This thickening process is precisely how dangerous blood clots are formed. That formed clot might remain quiescent for many hours, only to be dislodged when you shift your position in your sleep during the early morning hours, or as your blood pressure naturally begins to rise with the sunrise. Once dislodged, this clot embarks on a journey upwards, and within mere seconds, your brain is deprived of essential oxygen, ultimately leading to a stroke. Allow me to share the compelling narrative of Mr. Ellis Randall, a 75-year-old Vietnam veteran. A man characterized by his strong will and fierce independence, he would often jest that he could still outrun his grandson. Every night, Ellis slept on his right side, a habit he had cultivated during his military service, curling his arms snugly beneath his pillow to provide support for his neck. One morning, his wife discovered him in a precarious position, halfway out of bed, appearing dazed and entirely unable to move his left leg. He was promptly transported to the emergency room, where diagnostic scans revealed a stroke affecting the right side of his brain, caused by a clot that had lodged in his middle cerebral artery. What was particularly concerning to his medical team was that Ellis had no history of high cholesterol, he was not diabetic, and he did not smoke. So, the perplexing question arose, where did this clot originate? As his daily habits were meticulously reviewed, it became unequivocally clear that the chronic pressure exerted on his right side, coupled with years of sleeping with his arm trapped beneath him, had significantly compromised his vascular flow. An ultrasound, Examination revealed a notable narrowing of his carotid artery. Because he had been unknowingly reducing his blood flow for hours each night, a clot had formed silently during his sleep and tragically struck just before dawn. Ellis survived the stroke, but his mobility was significantly impaired, and he now walks with the aid of a brace, undergoing weekly therapy sessions to regain his coordination. He once confided in me with a sense of profound regret. I had no idea the way I slept could betray me. Here is the scientific reality of this situation. This sleeping position does not merely affect your arteries. It also exerts pressure on the brachial plexus, a critical bundle of nerves that traverses through your shoulder and extends down your arm. When this nerve bundle is compressed beneath your body weight, the nerves do not simply go numb. They transmit distress signals to your brain and can disrupt your sleep cycle without you even becoming consciously aware of the disturbance. Over an extended period, this chronic poor circulation and nerve stress can contribute to microvascular damage, the insidious kind that accumulates silently until it suddenly manifests as a breakdown in function. Older adults are particularly vulnerable to these effects because, with advancing age, blood vessels naturally tend to stiffen and narrow, and the viscosity of blood increases. Consequently, the body's recovery from periods of restricted blood flow takes longer, and the resilience of the nerves diminishes. Therefore, if you have a habit of sleeping on your right side, especially with your arm positioned underneath, it is absolutely imperative that you make a conscious effort to change this practice. This is no longer merely a matter of comfort. It is a critical step in avoiding life-altering consequences. Try switching to sleeping on your left side, ensuring your head is gently elevated and your arms are resting comfortably forward or alongside your body, not trapped underneath. Utilize a contoured pillow that maintains proper neck alignment and effectively reduces pressure on these key blood vessels. This single, seemingly small adjustment can represent the critical difference in protecting your independence, preserving your memory, maintaining your ability to embrace your family, walk your beloved dog, or even to speak your grandchild's name. You may not feel the insidious damage being done night after night, but your brain diligently remembers, your blood flow meticulously records these events, and eventually your body will inevitably react. Because what you remain unaware of while you sleep can fundamentally alter everything when you finally awaken. But if you perceive sleeping with your arm trapped to be a risky proposition, just wait until we delve into what transpires when your body engages in constant tossing and turning throughout the entire night, and how that very restlessness might be a critical red flag that your brain is desperately attempting to convey before a disastrous event unfolds. Allow me to illuminate the significance of this. As we navigate the natural progression of aging, a certain type of restlessness can subtly creep into our sleep patterns, disrupting the tranquility we seek. The inability to sustain sleep for extended periods, frequent awakenings from even light slumber, and the persistent, almost involuntary shifting from one side to the other are common complaints reported by many individuals. You might be inclined to dismiss this restlessness as an unavoidable consequence of aging, perhaps attributing it to the discomfort of arthritis, the increasing need for nocturnal bathroom visits, or other age-related bodily changes. However, what if I were to suggest that this persistent pattern of tossing and turning throughout the entire night could, in reality, be a crucial warning sign emanating directly from your brain, and even more concerningly, a potential trigger for a stroke? As a neurologist, I have come to view sleep not merely as a period designated for rest and physical recharge, but as a critical window of opportunity during which the brain actively engages in vital restorative processes, including the meticulous rebalancing of blood pressure, the efficient restoration of blood flow to all its regions, and the crucial clearance of accumulated metabolic toxins. When this vital physiological process is repeatedly interrupted, particularly in older adults whose bodies are less resilient, the consequences can be quietly yet profoundly devastating. Every time you execute a sharp, involuntary movement in bed, whether it be rolling over, repositioning your head, or adjusting your neck, you are, in effect, temporarily altering the delicate, finely tuned balance of blood flow to and from your brain. In a healthy 30-year-old individual, such momentary shifts in blood flow dynamics might have no discernible or lasting impact. However, in a 70 or 80-year-old person whose arteries have naturally stiffened over time, whose veins may have narrowed, and whose vessel walls might be inherently fragile, each of those movements can precipitate brief yet significant periods of reduced cerebral circulation. When you combine these transient reductions in blood flow with other contributing factors such as insufficient hydration during the night, diminished oxygen levels, or underlying blood pressure dysregulation, your overall risk factor for a cerebrovascular event escalates dramatically. But what is even more alarming is the emerging scientific understanding that frequent, restless movement during sleep might not simply be a passive byproduct of poor sleep quality. Rather, it could represent your brain's desperate, albeit unconscious, attempt to rebalance itself and restore optimal functioning. Allow me to share the illuminating experience of Mrs. Nancy Delgado, a 76-year-old retired piano teacher. Always characterized by her elegance, precision, and sharp intellect, she was the kind of woman who still meticulously ironed her pillowcases. Yet, for several months preceding her stroke, Nancy had been experiencing profound exhaustion upon waking, even though she believed she was sleeping for a full 7 hours. Her husband had remarked that she seemed to fidget constantly in bed, a pattern of turning from side to side occurring approximately every 10 to 15 minutes. Initially, they attributed this restlessness to the natural and unavoidable process of aging. However, this was soon followed by the onset of persistent headaches and early morning dizziness. Then, one night, she awoke with her right hand experiencing a peculiar numbness, and her ability to articulate words became noticeably slurred. Upon prompt transport to the emergency room, neurological imaging revealed that she had suffered a small ischemic stroke, likely occurring several hours before she fully awoke. Her subsequent sleep study and vascular scans indicated a concerning combination of poor overall sleep quality and intermittent hypoperfusion, transient episodes of reduced blood flow to the brain that occurred concurrently with her restless movements. Over an extended period, this unstable circulatory pattern led to blood pooling within her neck vessels, a condition that eventually culminated in the formation of blood clots. These clots were not attributable to high cholesterol or a pre-existing heart condition. Rather, they were a direct consequence of interrupted, unstable sleep, the very kind of sleep that deceives you into believing you are achieving restorative rest while your brain is silently and insidiously under siege. Mrs. Delgado's story is far more prevalent in the general population than we commonly realize. For senior individuals in particular, this type of fragmented sleep poses several significant and interconnected threats to their neurological health. It actively prevents your blood pressure from stabilizing effectively as normal. Deep sleep facilitates a controlled, restorative dip in blood pressure. It can lead to elevated cortisol levels, a stress hormone that, when persistently high during the night, can contribute to dangerous overnight blood pressure spikes, a recognized key trigger for morning strokes. It disrupts the functioning of the glymphatic system, which serves as the brain's natural waste removal and cellular cleanup crew, potentially leading to long-term vascular inflammation and damage. And critically, it creates constant and detrimental fluctuations in cerebral perfusion, the essential pressure gradient required to maintain adequate blood flow through the brain's delicate capillary network. These are not merely abstract medical terms or theoretical concepts. They represent tangible early warning signs that your body is diligently attempting to communicate to you. Your body has been whispering these critical signals to you throughout the entire night. Waking up drenched in sweat, gasping for air, or experiencing a racing heart. These are not just transient discomforts. They are your brain signaling an acute state of distress. Experiencing tingling sensations in your hands, a sense of imbalance, or a stiff neck upon waking in the morning. These are not simply minor age-related annoyances. They may very well be your body's desperate plea for improved sleep positioning, adequate hydration, and enhanced circulatory function. So, what concrete actions can you take to address this pervasive issue? The initial and most crucial step is to recognize and treat your restlessness as a critical symptom, rather than merely an unavoidable habit of aging. It is advisable to rigorously avoid caffeine and alcohol consumption in the late afternoon and evening hours. Maintain your bedroom environment at a cool, dark setting, but opt for layered bedding rather than excessively heavy sheets to effectively manage your body temperature throughout the night. Consider the utilization of a body pillow, which can help cradle your joints and prevent unconscious, jerky movements that disrupt sleep. Most importantly, if you or your partner consistently observe frequent awakenings or excessive movement in bed, it is highly recommended to consult with your physician about undergoing a professional sleep study. Mrs. Delgado now sleeps with a soft cervical pillow that provides excellent neck support, keeps a bottle of water readily accessible by her bedside, and practices slow, mindful breathing exercises before retiring for the night. Her recovery has been a gradual process, but she now profoundly understands the critical message conveyed by her body. I used to believe that waking up tired was simply a normal part of life. I never realized it was a warning that I was actively ignoring every single night. And she is unequivocally correct. Because when your sleep transforms into a nightly battlefield, your body meticulously remembers every disruption. But there exists another silent threat that works in insidious conjunction with poor sleep quality, a threat that often goes overlooked because its genesis begins long before you even contemplate going to bed. It commences the very moment you forget, or perhaps intentionally skip, something critically important: a dose of medication, a small pill, a simple established routine. That singular omission might very well be the only barrier standing between you and a life-altering stroke. Let us now meticulously discuss the dire consequences that can arise when you neglect to take your essential heart or blood pressure medications before bed. For a vast number of older adults, the daily ritual of taking prescribed medications becomes so deeply ingrained in their routine that it transitions into an almost automatic second-nature action. This pattern continues seamlessly until that particular night arrives when, for any number of reasons, the pill is forgotten, or perhaps, feeling perfectly fine physically, you rationalize the omission, telling yourself, just this once, it won't really matter. The bottle might be empty, you might be overwhelmed by exhaustion, or you might harbor concerns about potential side effects, however unfounded they may be. And thus, you bypass that small pill, the one meticulously designed to regulate your blood pressure or maintain the steady rhythm of your heart. What you may profoundly fail to comprehend is that a single missed dose, particularly when taken prior to sleep, has the potential to transform into a silent overnight danger, the consequences of which can be catastrophic. And for seniors, this danger can manifest in a way that is irreversible. A stroke that arrives before the morning light, striking without the slightest hint of a warning sign, not even a solitary tremor or a brief moment of dizziness. Let me elucidate precisely the physiological mechanisms that precipitate this dangerous outcome. Your blood pressure naturally adheres to a specific rhythm, typically exhibiting a rise in the early morning hours and a gentle decline during the nocturnal period. This natural dipping phenomenon is, in essence, the body's mechanism for resetting and recalibrating its systems. However, if you suffer from high blood pressure, atrial fibrillation, or any other cardiovascular condition, your body's capacity to effectively regulate this vital physiological rhythm on its own is significantly impaired. This is precisely where prescribed medications play their indispensable role. They provide the necessary stability when your own system is unable to maintain it independently. But when you omit your evening dose of medication, especially if it falls into the category of beta blockers, calcium channel blockers, ACE inhibitors, or anticoagulants, a disturbing physiological event can occur. Your blood pressure may experience a significant surge overnight, often occurring between the critical hours of 2 a.m. and 6 a.m., the very period during which the majority of strokes tend to occur. Your heart might begin to race or develop an irregular rhythm, and if your blood vessels are already compromised by age, the accumulation of cholesterol or inflammation, that sudden unchecked surge in blood pressure can lead to blood pooling, stagnation, and the subsequent formation of clots. These are not clots that, unfortunately, will remain silent for long. Allow me to share the impactful story of Mr. Harold Green, a 72-year-old retired electrician. Harold was a man of exemplary diligence and a keen awareness of his health. He consistently engaged in regular walks, adhered to a sensible diet, and never smoked. He did, however, suffer from mild hypertension, and his physician had prescribed a low-dose medication to be taken once daily in the evening. On one particular evening, Harold became deeply engrossed in watching a sporting event, became distracted, and completely forgot to take his prescribed pill. He rationalized his omission, telling himself that it was not a significant issue and that he would simply take it in the morning, but tragically, he never had the opportunity to do so. The following day, Harold awoke with a peculiar sensation, feeling something was amiss. His wife quickly noticed that his face appeared different, and when he attempted to speak, the words obstinately refused to form. Within the span of an hour, he was admitted to the hospital, suffering from a moderate ischemic stroke. Medical examinations revealed a small clot lodged in the left hemisphere of his brain, a clot that had likely formed during the early morning hours when his blood pressure had surged unchecked, a direct and tragic consequence of the missed medication. The most devastating aspect of this event? Harold had no inkling that the risk was so immediate and profound. He harbored the assumption that one skipped dose could not possibly inflict significant harm. However, in older adults whose arteries possess diminished elasticity and whose blood naturally becomes thicker with age, such an omission can represent the critical tipping point. Physiologically, here is precisely what unfolds. Blood pressure. Medications function by effectively reducing the inherent stress placed upon your heart and blood vessels. When that crucial protective medication is skipped, that essential shield is, in effect, removed. Pressure begins to build within the vascular system. The delicate inner lining of your arteries becomes irritated, and platelets, the tiny cellular components responsible for initiating blood clotting, become significantly more active, and where there is increased pressure and turbulent blood flow, the formation of a clot becomes highly probable. In senior individuals, the margin for error is exceptionally narrow. A single skipped medication can be the stark difference between experiencing a stable, healthy night and facing a morning that irrevocably alters your life forever. Harold is currently undergoing intensive therapy to facilitate his recovery, but he now adheres to an unwavering medication schedule with absolutely no exceptions. He carries a pill reminder diligently in his pocket and confessed during a follow-up consultation, "One night cost me my words. I will not permit it to cost me anything else." If you are currently taking medications for blood pressure or heart conditions, even low-dose aspirin or blood thinners, it is of paramount importance that you take them consistently and without fail. Set audible reminders on your phone or smartwatch. Enlist the support of a trusted loved one to check in with you regarding your medication schedule. Keep a backup pill organizer discreetly beside your bed. Because at this stage of your life, your brain relies on consistent routine even more critically than your memory does. And remember, the danger does not solely lie in what you actively do to safeguard your health. It also resides in what you inadvertently fail to do, even just once, that can meticulously undo years of diligent effort and self-care. But what if the source of the danger does not originate from within your own body, but rather from the external environment surrounding you? From the chilling touch of cold air brushing against your neck as you sleep, from the inadequate support provided beneath your head, or from the very air you breathe. You might be genuinely surprised at how swiftly these subtle environmental factors can negatively impact your brain's function, and it has absolutely nothing to do with mere comfort. Allow me to illustrate precisely why this is the case. We frequently associate the advent of cold nights with the promise of enhanced sleep quality. That invigorating crispness of the air, the refreshing sensation of cool sheets against the skin, the way your body instinctively curls into a state of warmth beneath a blanket. All these elements can feel deeply restorative and invigorating. Many seniors even opt to reduce their thermostat settings significantly, believing it to be a healthier practice or a more energy-efficient approach to managing their household expenses. But what if that deliberately cooled room, particularly when coupled with inadequate support for your neck, was accomplishing far more than simply inducing shivers? What if it was silently, yet effectively, constricting blood flow to your brain, leading to the tightening of your arteries, and thereby significantly increasing your risk of experiencing a stroke during the very hours when you believe you are achieving your most restful sleep? Most senior individuals are entirely unaware of the profound impact that both ambient temperature and sleeping posture can have on their vascular system. As we age, our bodies become progressively less efficient at regulating our internal temperature, a phenomenon that is particularly pronounced during the nocturnal hours. Exposure to a cold environment triggers a physiological response known as vasoconstriction, which is the narrowing of blood vessels. This effect becomes particularly dangerous when it occurs in the neck region, where two critically important arteries, the carotid and vertebral arteries, are responsible for supplying your brain with the essential oxygen-rich blood it requires. Now, imagine your neck being slightly bent at an incorrect angle, resting on a soft, unsupportive pillow, or even worse, left entirely unsupported throughout the night. This subtle misalignment, when combined with the cold-induced narrowing of your blood vessels, significantly reduces the crucial flow of blood to your brain. In an aging body, where arteries have already lost some of their natural flexibility and where blood circulation is inherently slower, this creates a scenario ripe for a potentially deadly combination: restricted blood flow, the pooling of blood, and the subsequent increased likelihood of blood clot formation. Allow me to share the instructive story of Miss Loretta Dixon, a 78-year-old retired nurse. Loretta possessed a remarkably sharp mind, brimming with stories and a quick wit. She had always harbored a preference for sleeping in a cool bedroom and would habitually sleep with her window slightly ajar, even during the deepest periods of winter. Her typical sleeping posture involved curling up tightly, her neck slightly tucked towards her chest, with only a flat, unsupportive pillow placed beneath her head. She considered this to be a perfectly normal, even healthy sleeping habit. Then, one morning, Loretta did not wake up. With her usual promptness, her son discovered her in a state of partial alertness, but unable to focus her eyes. Her speech was notably slurred, and she was unable to sit up on her own. Upon arrival at the hospital, diagnostic scans revealed a brainstem stroke, a particularly dangerous and often devastating type of stroke caused by a clot that had lodged in the posterior circulation, the vital area supplied by the vertebral arteries, which run along the spine and pass through the neck. There was no pre-existing history of heart disease, no history of smoking, and no instances of skipped medications. However, there was one highly probable culprit that emerged: chronic neck compression in conjunction with cold-induced vasospasm during sleep. Over an extended period, these two factors had cumulatively reduced blood flow just enough to allow a clot to form, which then unfortunately traveled into the most vulnerable and critical part of her brain. Loretta is now undergoing extensive and intensive physical therapy. She requires assistance for walking and experiences significant difficulties with swallowing, a painful yet tangible reminder that what we might casually overlook as minor discomfort can, in fact, irrevocably alter our lives in the span of a single night. Cold temperatures induce a narrowing of blood vessels, and poor neck support leads to a misalignment of those vital vessels. Together, these factors silently reduce the delivery of oxygen to the brain, especially during the critical early morning hours, when blood pressure naturally tends to exhibit a significant spike. If your brain is already experiencing reduced oxygen levels and your cervical blood vessels are constricted, even a relatively small blood clot can cause devastating and widespread damage. And here is a crucial piece of information that most individuals fail to recognize. Many senior individuals already experience some degree of cervical spondylosis, a condition that refers to age-related degenerative changes in the neck spine. When you combine this pre-existing condition with the lack of adequate pillow support within a cold room environment, the risk of substantially reduced blood flow to the brain increases dramatically. So, what specific adjustments should you consider making to your sleep routine? It is advisable to maintain your room temperature at a cool setting, but avoid extreme cold. The optimal sleep temperature for older adults is generally considered to be around 65 to 68 degrees Fahrenheit, approximately 18 to 20 degrees Celsius. Crucially, ensure that your neck receives adequate and proper support. Utilize a medium-firm pillow that maintains your head in alignment with your spine rather than allowing it to angle downwards or twist sharply to one side. Actively avoid sleeping with your chin tucked deeply into your chest or with your head cocked unnaturally to the side. These subtle yet deliberate adjustments may seem insignificant in the grand scheme of things, but they represent powerful acts of protection, a tangible way of ensuring that your brain receives the essential nourishment it requires to function optimally while you are in the state of sleep. Loretta recently confided in me, "I never truly comprehended that something as simple as the cold or the type of pillow I used could actually harm my brain. I simply did not possess that knowledge." And that, unfortunately, is the most frightening aspect of this issue. So many seniors remain unaware of these critical risks. They continue to engage in practices that feel natural, habits they have maintained for years without realizing that the aging body operates under entirely different physiological rules. But sometimes the source of the danger does not originate from the position in which you sleep, but rather from what you did in the hours immediately preceding your falling asleep. Because the final habit we will discuss might very well be the most misunderstood of all. What precisely happens when you proceed to bed immediately after consuming a heavy meal or indulging in more than a moderate amount of alcohol? What are the specific effects that late-night digestion or alcohol consumption exert on your heart, your blood pressure, and ultimately your brain while you are in a state of rest? Allow me to guide you through this critical analysis, because this last habit could very well be the hidden trigger that pushes everything over the edge into a dangerous outcome. There exists a pervasive belief, deeply ingrained in the minds of many as they transition into their later years, that consuming a substantial meal and enjoying a glass or two of wine or spirits significantly enhances the quality of their sleep. The sensation of warmth, the feeling of comfort, the ritual of winding down the day with a hearty dinner followed by a nightcap is a cherished and deeply ingrained custom in countless American households. However, as a neurologist specializing in the brain, I must impart a vital piece of information that you may very well never have encountered before. The act of going to bed immediately after consuming a heavy meal or imbibing alcohol can silently trigger the very kind of stroke that can rob you of everything that matters. Your ability to articulate, your capacity to remember, your cherished independence, and often it does so before you even begin to grasp what is happening. The aging body processes food, alcohol, and stress in a fundamentally different manner than it did in younger years. What once brought comfort and relaxation can, in older adults, transform into a silent yet profoundly insidious danger. When you consume a large, often fatty meal late at night, particularly one that is rich in sodium or sugar, your digestive system is compelled to work overtime. This intense digestive effort diverts vital blood flow away from your brain and redirects it towards your gastrointestinal tract to efficiently process the ingested food. While this temporary reduction in brain circulation might not feel dramatically noticeable at the moment of consumption, if your arteries are already narrowed due to the natural process of aging, the consequences can be quite significant and far-reaching. Now, when you introduce alcohol into this already precarious scenario, you are effectively creating a perfect physiological storm that can compromise neurological function. Alcohol initially acts as a vasodilator, meaning it causes your blood vessels to widen, which is why your face might flush or you may experience a sense of drowsiness after consuming a drink. However, As the effects of the alcohol begin to wear off, your blood vessels can suddenly constrict again, leading to a subsequent surge in blood pressure. Your heart is then compelled to work harder to stabilize itself. In senior individuals, this abrupt physiological shift can trigger cardiac arrhythmias, induce sharp fluctuations in blood pressure, and ultimately lead to a reduced supply of oxygen to the brain. All of these contributing factors, operating in tandem, silently yet effectively, increase your risk of experiencing a stroke, particularly during the vulnerable hours of sleep when your body is most susceptible to these physiological disturbances. Allow me to recount the poignant story of Mr. Gerald Thompson, a 74-year-old retired farmer. Gerald was a man known for his inherent discipline and unwavering strength, and he cherished one simple yet profound joy: his evening routine. His dinner was typically served at 7 p.m., followed by a glass of bourbon at 8 p.m., and he would retire to bed by 8:30 p.m. One winter evening, he decided to indulge in a special holiday dinner. He enjoyed a generous portion of turkey, creamy mashed potatoes, rich gravy, a slice of decadent pie, and his customary evening drink. He felt utterly satisfied, even proud of his ability to enjoy such a celebratory meal. But that night, something changed irrevocably within him. Around 4 a.m., his wife awoke to find him cold to the touch and completely unresponsive. He was swiftly transported to the emergency room, where a CT scan tragically revealed a massive ischemic stroke affecting the frontal lobe of his brain, caused by a clot that had formed and subsequently traveled during the night. The medical team found no signs of atrial fibrillation, no recent infection, and no history of skipped medications. What they did discover, however, were significantly elevated triglyceride levels following his large meal, dehydrated blood, and constricted blood vessels resulting from the alcohol's rebound effect. This devastating combination of factors had reduced circulation to his brain just long enough to allow a clot to form silently and tragically fatally. Gerald survived the stroke, but it tragically stole his ability to speak. His wife, who is now his devoted full-time caregiver, tearfully recounted to me, "We believed we were doing everything right. We had no idea that dinner and a drink could take him from me." The stark and painful truth is that the processes of digestion and alcohol consumption actively compete with your brain for vital physiological resources. After the age of 60, the digestive system naturally slows down considerably, meaning that food remains in the stomach for extended periods, drawing essential blood flow away from the brain for hours. Alcohol further dehydrates the blood and can disrupt your natural heart rhythm. When these two forces are combined, they create an environment of unstable blood pressure, encourage the formation of blood clots, and reduce cerebral perfusion, particularly during the early morning hours when cortisol levels surge, a time when strokes are most prevalent. If you choose to consume alcohol, it is advisable to do so in moderation and ideally earlier in the day. If you enjoy a substantial meal, it is highly recommended to establish a practice of allowing at least 2 to 3 hours to pass before lying down to sleep. Ensure that you consume ample amounts of water with your dinner. Avoid salty, greasy, or overly sugary foods late at night. And critically, do not mistake alcohol-induced drowsiness for healthy restorative sleep, as alcohol-induced sleep is inherently fragmented and profoundly disruptive to optimal brain function. This advice is not intended to suggest that you should never again enjoy food or a drink. Rather, it is about fostering a respectful understanding of what your body needs and what it can safely handle at this particular stage of your life. You have diligently worked to build a life that brings you joy and fulfillment. Do not permit a simple dinner routine or a casual drink to undermine the foundational bedrock of health that you have so diligently constructed. Because when it comes to the devastating threat of a stroke, the danger does not always arrive with a preceding pain or obvious discernible warning signs. Sometimes it arrives quietly, subtly disguised within the guise of comfort, or masked as a familiar, harmless routine. And now that we have meticulously uncovered the 9 most potentially dangerous sleeping habits that could be silently elevating your risk of experiencing a stroke overnight, you might naturally be wondering, what does truly safe and protective sleep actually look like? What specific changes can I begin implementing starting tonight, not merely to sleep better, but to actively and effectively protect my brain for the long term? Let us now bring all of these crucial pieces of information together, and I will guide you through the habits that actively promote healing rather than inadvertently causing harm. Because genuine prevention of neurological events begins with a profound awareness of the risks, and the inherent power to enact lasting positive change begins with you. Sleep is not simply a period designated for physical rest. It is a critical window of opportunity for protection, a time when your brain actively engages in vital restorative processes. If you have diligently read through all of this information, I wish to express my sincere gratitude, not only for your time in reading, but for demonstrating a profound and commendable commitment to understanding the truth about how sleep can silently, yet profoundly, shape the future health of your brain. What you have just learned is not intended to instill fear or anxiety, but rather to empower you with knowledge. It is the kind of empowering knowledge that arises from genuine awareness, from understanding precisely what is occurring within your body while the rest of the world remains in slumber. At this particular stage of your life, possessing this knowledge is not merely helpful, it represents your most potent and effective protective measure against potential harm. And every conscious decision you make from this point forward, no matter how seemingly insignificant or minor it may appear, carries far more profound weight and carries far greater significance than it did decades ago. We have delved into 9 silent habits that on the surface may appear entirely harmless. Familiar positions of comfort, deeply ingrained routines of familiarity, decisions made out of necessity due to pain or overwhelming fatigue. But each one of these habits possesses the potential to slowly, subtly, and insidiously nudge your brain towards a state of danger. These include sleeping flat without any pillow support, sleeping face down on your stomach, sleeping in a recliner, sleeping with a heavy blanket pulled over your head, sleeping on your side with your arm trapped underneath, experiencing constant tossing and turning throughout the night, skipping essential medications, sleeping in a cold room without adequate neck support, or going to bed immediately after consuming a heavy meal or alcohol. Each of these practices, when engaged in over an extended period, creates the ideal physiological conditions for blood to stagnate, to thicken, and consequently to form dangerous blood clots. And within a body that is already navigating the natural, inevitable changes of aging, characterized by stiffer arteries, slower circulation, and diminished oxygen levels, these clots are not merely a possibility, they are an increasingly likely occurrence. But here is the most crucial and empowering truth I can offer. You, as your dedicated physician, the vast majority of strokes that occur during sleep are, in fact, entirely preventable. Allow that profound realization to fully sink in for a moment. These events are not predetermined or inevitable. They are not random acts of fate or chance. They are, in many instances, the direct and predictable result of routines we never adequately questioned, physiological signals from our bodies that we consistently ignored, or comfort habits that, as we age, no longer serve our best interests. Therefore, if there is one singular overarching message that I hope you will carry away and actively implement from this comprehensive information, it is this. You still hold the ultimate reins of control over your health. You still possess the inherent ability to fundamentally alter the way you sleep, to actively and consciously care for your brain's well-being, and to effectively safeguard your future health and independence. Because sleep is not merely about achieving rest, it is the essential time when your brain diligently works to restore optimal blood flow, efficiently clears out accumulated metabolic toxins, balances essential hormones, and meticulously prepares itself for the demands of another day. Sleep is the period when your brain is at its most vulnerable, but it is also, critically, when it is most receptive to healing and rejuvenation, provided you consciously allow it to be. Begin implementing these changes tonight. Elevate your head slightly when you sleep. If it is feasible and comfortable for you, try sleeping on your left side. Ensure that your neck is adequately and properly supported throughout the night. Make a conscious effort to avoid late-night alcoholic beverages and heavy meals. Take your prescribed medications without fail and without exception. Choose breathable, natural bedding materials. Stay consistently hydrated throughout the day and evening. Create a sleep environment that genuinely honors the years you have lived and the vibrant, fulfilling life you still aspire to enjoy. These are not drastic, life-altering changes that will require immense sacrifice. They are subtle yet profound shifts, but they carry immense, potentially life-saving weight. In a world that often presents us with circumstances far beyond our control, this is one fundamental and critical aspect of your health where your conscious, deliberate decisions matter profoundly every single night. You are not too old to implement these changes. You are not too far along in life to protect yourself effectively, and you are never, ever too late to learn how to sleep, not just for the sake of comfort, but for the ultimate purpose of survival and sustained well-being. As I frequently advise my patients, it is not solely about the quantity of sleep you manage to achieve, but rather about the wisdom and intention with which you approach your sleep. So tonight, as you prepare to pull back the covers and lay your head down, I urge you to ask yourself a critical and introspective question. Is the way I am currently sleeping actively helping my brain, or is it subtly and insidiously causing it harm? Because when you actively and consciously protect your sleep, you are in essence protecting everything that truly matters. You are protecting your ability to speak, your capacity to remember, your sense of balance, your cherished independence. You are protecting the very essence of who you are as an individual, and that, without any question whatsoever, is always profoundly worth the effort. These lessons are meticulously designed to inspire you to live your life fully, authentically, and with the utmost vitality. Now, I would be absolutely thrilled to hear from you and engage in a dialogue. Please take a moment to reflect upon what you have learned and then share one specific piece of information that has resonated with you and that you plan to actively implement in your own life starting immediately. Let us collectively support each other on this vital journey toward embracing these fundamental truths. If you found significant value in the information presented in this discourse, please leave a comment with the number 1. If, however, you did not find it particularly helpful or relevant, feel free to comment with the number 0. Your honest feedback is invaluable to us as we strive to provide the most relevant and impactful content possible. And as a final request, please do not forget to like this content, share it with your friends and family, and subscribe to our YouTube channel for access to more essential content like this. Thank you sincerely for your time and attention in watching, and here's to living your life on your own terms with unwavering clarity and enduring vitality.